Afternoon, how are you? It's about 9:15 in the morning. I've been up since about 4. So, yeah. Okay.
By the BC Lung Association, and this is.
Sorry, would you mind just starting that over again?
Sure, I can do that. That's why we're taping, right?
Anytime.
So I'm Veda Peters. This is the 11th annual Health, Air Quality and Health Workshop podcasts, and I'm here Skyping with Dr. Craig Dalton from the School of Medicine and Public Health, University of Newcastle in Australia. And we're going to talk about coal transport and rail corridors and health. So Dr. Dalton, what are the health effects or concerns that have been associated with coal transport?
Well, let me start with the concerns because we know the concerns well. The actual health effects we don't know well. So concerns tend to relate to the traditional conditions that are known to be associated with coal mining. So people are concerned about respiratory health effects such as asthma, emphysema, and some of the coal miners' lung diseases. People raise issues of lung cancer as well. Of course, it's not likely that the people living beside rail corridors will experience the same health impacts as coal miners, but these are sort of issues that people raise. Additionally, in broader scoped health impact assessments, people raise the issue of noise from coal trains, accidents, and general industrial infrastructure and the impact from stress and development.
And so what is the size of the exposed population? Do we have any idea?
Well, yeah, it's quite variable. It depends on the density of the city and the population around the rail corridor, and of course it depends on how big a health impact you think you're having in terms of how broad the exposure is. So, if you take in our main city of Newcastle, where the coal flows along the main rail corridor to the largest coal exporting port in the world, Port of Newcastle, there may be between 10 to 50,000 people within, 100 metres to a kilometre, either side of the rail corridor, depending on how you plot your exposed area. So it depends on what you think is coming out of the coal trains. If it's just PM10s, the larger but still respirable particles that leave coal dust, then you might be thinking about the first 50 to 100 metres of impact. If you're talking about PM2.5, then from diesel, the very small particles that come from combustion from the diesel locomotives and coal trains, this is going to have more of a broader regional impact, and you're talking about contributing to an overall regional PM2.5 level, not just something that occurs and impacts people on the side of the tracks.
Okay, and are there populations that are more vulnerable than others?
Well, of course, in any port, any industrial development, and including rail corridors, people raise issues of environmental justice, and industrial areas and rail corridors, of course, tend to have lower socioeconomic groups living alongside them. Not always, but there do tend to be increasing rates of low ACS, which may mean they have higher rates of underlying cardiovascular or respiratory disease.
Interesting. So do we know the level of risk for these populations?
What I can say is that there's been lots of studies looking at the relative increases in dusts, PM10, PM2.5s, beside rail corridors, particularly in our town. Unfortunately, they've just focused on what's happening right in the rail corridor and using different methods and different research questions. The problem with that is that we almost had dueling studies, different constituencies, industry, community doing their own studies, and it's not really informing the broader research questions and perhaps not the broader questions of the community about what is the actual health impact. So the biggest gap we have now is knowing what's happening in the community. The EPA monitors, which are sort of close to the rail corridors, don't find any breaches. But closer into the corridor, we really need to get an idea of what's happening. To do that, though, we need to bring these currently conflicting groups together to agree on the questions, on the methods, on the analyses, and then we need to take those questions, those methods, and put them out to peer review before any data is collected. And that is the biggest challenge we have. We don't need another study that then gets disputed for another 3 years. We need to bring the groups that are currently in conflict together to develop the one study that will answer everyone's questions. That's the biggest gap in our knowledge at the moment, how to do that. I
see. And are there approaches to resolution of that problem?
There are. They sometimes sit uncomfortably with groups because it's a new way of doing things, but there are excellent environmental conflict resolution methods. One of the methods is called a collaborative, and it basically brings all the stakeholders together to work through the entire process transparently together. And it's been tried in many different settings and has worked well.
Oh, that's good to hear. That's excellent. So that basically answers my questions, and thank you very much for being willing to participate from such a distance.
Thank you. It's been very useful. I've learned a lot listening to the conference this morning.
Excellent. Thank you.
Yeah. Thank you.